Today we're diving into a little pill that millions of people with type 2 diabetes take every single day, Glimepiride. Now, this is a fascinating one. It's a powerhouse of a medication because it doesn't actually contain any insulin, but boy, does it know how to get your body to release its own.
So that's the big question, right? How in the world does one simple, once-a-day pill send such a powerful command to an organ as complex as the pancreas? How does it convince it to start fighting high blood sugar all by itself? Well, let's get into it.
So what is Glimepiride at its core? It's an oral medication, you just swallow it, and its main job is to stimulate your pancreas, to kind of poke it and say, hey, release more insulin. And this is a really crucial point. This is only for type 2 diabetes. You might be wondering why. Well, because it needs a pancreas that's still working to talk to. In type 1 diabetes, the pancreas can't make insulin anymore, so this pill would basically have no one to deliver its message to.
To really appreciate what this pill does, we first have to understand the problem it's trying to solve. Uncontrolled high blood sugar, or hyperglycemia, isn't just about feeling a little off. We're talking about something that, over time, can cause really serious damage to your eyes, your kidneys, and your nerves. So Glimepiride is a tool, a really important one, for getting those sugar levels back under control and hopefully reducing the risk of all those long-term complications.
Okay, now for the main event. How does this thing actually work? How does it unlock your body's own insulin supply? This is where it gets really cool, because a simple pill is about to trigger a very complex and honestly, a pretty elegant biological chain reaction. Let's start with a simple way to picture this. Think of Glimepiride not as the insulin itself, but as the key. See, your pancreas has all this insulin stored away in these special cells, just waiting for the signal. This pill's one and only job is to travel to the pancreas, find the right door, and turn the key that opens the floodgates.
So how does that key actually work? It's like a 5-step domino effect. First, the drug binds to what are called beta cells. These are the little insulin factories inside your pancreas. That action immediately closes these tiny little doors called potassium channels on the cell's surface. Now, closing those doors messes with the cell's electrical balance. It's a process called depolarization. This electrical shift is the signal for another set of doors, the calcium channels, to swing open, letting calcium flood into the cell. And that rush of calcium, that is the final trigger. That's the signal that tells the cell, okay, time to release the insulin.
So after all that complex biology, the channels, the ions, the electrical charges, what it all boils down to is really simple command. The pill shows up and basically tells the pancreas, hey, we need more insulin out here, right now. And it's especially good at doing this right after a meal, which is exactly when your blood sugar starts to climb.
Now, while telling the pancreas to release insulin is its main gig, Glimepiride kind of has a few side hustles. It's also thought to have some smaller effects outside of the pancreas. For instance, it might help your muscles and fat cells become a little more sensitive to the insulin that's now in your system. And it can also gently tell the liver, hey, maybe produce a little less of your own sugar. But make no mistake, its star power, its main job is talking to the pancreas.
Okay, so the message has been delivered loud and clear. But what happens to the messenger? What's the pill's journey look like? Let's trace its path through the body over a full 24 hours.
All right, so once you take it, Glimepiride gets completely absorbed from your gut into your bloodstream. From there, it hitches a ride, with over 99% of it grabbing onto proteins to travel around. Its next big stop is the liver, which is like the body's main processing plant. There, a specific enzyme, CYP2C9, gets to work breaking the drug down. And finally, once it's all processed, it's ready to be kicked out of the body.
So after the liver has done its job, the leftovers have to go somewhere. And it's a pretty clean split. About 60% of it is excreted through your urine, and the other 40% leaves through your feces. A very neat and tidy exit strategy.
And this number is what makes this drug so convenient for so many people. Now, technically, its half-life is shorter, around 5 to 8 hours, but its actual blood sugar lowering effect, that lasts for a full 24 hours. And that's why it's a once-a-day pill, which makes it so much easier for people to actually stick with their treatment plan.
So we've covered the science, which is pretty cool, but now let's switch gears and look at the practical side. How is Glimepiride actually used out in the real world by doctors and patients?
The approach is almost always start low and go slow. A patient will usually begin with a really small dose, maybe 1 or 2 milligrams a day, typically taken with their first big meal. Then, depending on how their blood sugar responds, the doctor will gradually increase that dose over weeks until they find the sweet spot, topping out at a maximum of 8 milligrams a day.
Now, this is so important to remember. Glimepiride is not a magic bullet. It's not a standalone cure. It's what we call an adjunct. It's a helper. It's meant to work alongside the true cornerstones of diabetes management, which are always going to be diet and exercise. And very often, it's used in combination with other diabetes drugs, like metformin, that work in totally different ways. The goal is to attack the problem from multiple angles for better overall control.
But you know, like any powerful tool, Glimepiride is not without its risks. And to really understand where it fits in modern medicine, you have to look at both sides of the coin, the good and the not so good.
Let's just cut right to the chase. The single most important risk, the thing everyone needs to know about, is hypoglycemia. That's just a fancy word for low blood sugar. Because the drug is literally forcing the pancreas to pump out insulin, sometimes it can do its job a little too well, pushing blood sugar levels way too low, and that can actually be dangerous.
So knowing the signs is absolutely critical. It can start out feeling like you're just shaky or sweaty or suddenly intensely hungry. But it can get worse, leading to dizziness, confusion, even heart palpitations. And in really severe cases, it can cause seizures or even loss of consciousness. The risk gets even higher if you skip a meal, drink alcohol, or exercise way more than usual without adjusting things.
Yeah, hypoglycemia is by far the biggest concern. Another pretty common side effect is some modest weight gain, which makes sense when you remember that insulin is a hormone that can promote fat storage. And then, less commonly, some people might experience GI issues like nausea.
All right, let's sum it all up. The advantages? They're pretty clear. Glimepiride is powerful and effective. It's convenient because it's once a day, and it's generally very low cost. But the disadvantages are also pretty significant. You've got that high risk of hypoglycemia, the tendency to cause weight gain, and this other thing called secondary failure. What that means is after years and years of being stimulated, the pancreas can just get worn out and become less able to produce insulin, which makes the drug not work as well over time.
So, when you put it all together, Glimepiride is still a cornerstone of diabetes therapy, for sure. But it is absolutely not for everyone. Its use really demands careful patient selection and, most importantly, constant, vigilant monitoring to make sure patients stay safe.
And that kind of leaves us with one big final thought. We live in an era where there are tons of newer diabetes drugs, many of which work in different ways and come with fewer risks. So, in this modern landscape, what is the right place for an older, powerful, and cheap drug that also carries such a serious warning label? Well, that is the tough question that doctors and their patients have to answer together every single day. Thanks for joining me on this one.